A 42-year-old woman comes to the office for a follow-up visit. She has been following a weight loss program with dietary modification and exercise for the past several months. The patient weighs 110 kilogram and is 170 centimeter tall. BMI is 38. In the last 6 months, she has lost 3% of her initial body weight on a balanced, low-calorie, around 800 kilocalorie per day diet. The patient has been strictly adhering to dietary recommendations and exercising as much as possible, but feels she is not making progress. She also reports feeling hungry all of the time. The patient says she is motivated to lose weight but is starting to feel discouraged by her results. Medical history includes hypertension, type 2 diabetes, and obstructive sleep apnea. Blood pressure is 140 by 80 and pulse is 78 beats per minute. Physical examination shows an obese habitus but is otherwise normal. The question is, which of the following is the most appropriate next step in management of this patient? Your options are Choice A, bariatric surgery referral. Choice B, further reduction of caloric intake. Choice C, low-carbohydrate diet. Choice D, phentermine for appetite suppression. Choice E, strict 60 minutes of daily aerobic exercise. Type your answer in the comment box. Congratulations if your answer is A, which is bariatric surgery referral. This patient has obesity and multiple weight-related comorbidities, including type 2 diabetes, mellitus, hypertension, and obstructive sleep apnea. Her weight has failed to improve despite appropriate dietary modifications and exercise. Therefore, medical weight loss intervention is indicated. Appropriate options include weight loss medication and referral for bariatric surgery. Weight loss medication is indicated for patients with a BMI more than 30 or obese, and those with a BMI of 25 to 29, which are overweight with weight-related complications. Primary options include orlistat, lorcaserin, naltrexone, bupropion, phentermine, topiramate, and liraglutide. The choice of drug is individualized based on comorbidities, concurrent medications, and side effect profile. However, sympathomimetic weight loss medications, example phentermine monotherapy, are usually avoided because although they can induce short-term weight loss, they are associated with extensive regain and minimal long-term benefit, which is the choice in D. Weight loss or bariatric surgery is indicated for patients with a BMI greater than or equal to 40, and those with a BMI greater than or equal to 35 and additional weight-related comorbidity. Although non-surgical interventions are often attempted first, medication failure is not required to qualify for weight loss surgery, and both interventions may be pursued concurrently, with medication prescribed while the patient is undergoing preoperative evaluation. If you chose any option other than A, you were incorrect. Let's briefly discuss the other options. Choice B cannot be the answer because moderate caloric restriction, example 1500-2000 kcal day, is usually adequate for producing weight loss in obese patients. A caloric restriction of 800-1500 kilocalorie per day is generally considered the most aggressive diet that can be sustained. Very low-calorie diets, less than 800 calorie per day, have a high failure rate and usually do not yield greater long-term success than conventional diets. Choice C cannot be the answer because weight loss diets with various macronutrient contents, example low-fat, low-carbohydrate balanced, have been advocated, but the ideal diet appears to be determined by individual factors and preferences. This patent has already tried a fairly aggressive diet. Changing the macronutrient content may make a small difference, but is unlikely to provide significant sustained weight loss. Choice E cannot be the answer because exercise should be included in any comprehensive program to enhance weight loss, reduce regain, and improve overall well-being. However, exercise alone does not typically lead to significant loss and is unlikely to help this patient achieve her goal. If you're finding this difficult to understand, consider watching this episode again.